Once our anesthetic procedure is finished and the patient is safely in recovery, it's time to gather all of the important documents to complete the medical record for today's procedure. First document that you want to make sure is completely filled out is our anesthetic monitoring. So most anesthetic monitoring forms each vary slightly, but the first part is the information and signalement of the pet and the owner and the performing doctor. So again, we'll have the name of the pet, the owner's last name, any identification required for the clinic, such as an account number, the breed of the animal, and the procedure that's being performed, today's date, the continued part of the signalment, the sex, age, and weight of the patient. Our weight here is written in pounds and kilograms. In the IV catheter, size, location, the doctor that is performing the procedure, the technician or anesthesiologist that is monitoring the patient, the start of the procedure, and the end time of the procedure. We have additional information, whether or not an e-collar is necessary for the patient for this procedure, any additional things such as implanting a microchip while they're under anesthesia, and a section to write home, to go home medications to be filled later. The next section is our pre-medication and induction agents record. Here we're going to write down the names of the medications that are being used and their concentrations, as well as the dose that we are using, the translated volume that we're going to be using for this patient, the route at which we are going to be giving the medication, and the time at which we give them. There's a comment section here for record keeping, as far as if we want to control or keep track of the bottle numbers that we're using, or especially if the pet has any adverse reactions to the medications that were used. The next section here is the anesthesia information, so marking the type of anesthesia that we are using, this case isoflurane versus sevoflurane, the oxygen flow rate, the endotracheal tube size, the type of thermal support that we are providing for our patient, whether it is a warm circulating blanket or a hot air blanket, and then whether or not we're using a non-rebreather. The next section is our anesthesia monitoring, which is the vaporizer setting throughout the procedure. It is marked in 5-minute intervals, starting with a 0 to 8%, so whether or not you're using, in this case, isoflurane or sevoflurane. And again, it is marked every 5 minutes. This way you can see the trends of how the pet handled anesthesia, ideally trying to keep them at the most adequate plane of anesthesia throughout the procedure. The next section is our fluid administration. We have the fluid type and the fluid rate at which we're going to be doing throughout the procedure. At 5-minute intervals, we can total up the amount of fluid that the patient receives. Any changes that need to be made in our fluid administration should be noted as well. The bottom part here is our vital monitoring. So every 5 minutes when we're taking our vitals, considering our pulse ox, our heart rate, respiratory rate, CO2 production, capillary refill time, and blood pressure, and temperature as well. Again, this is mainly for seeing how our patient is handling anesthesia, following any trends that can help us determine whether or not we need to adjust our vaporizer settings, adjust our fluid rates, and that kind of thing. The bottom section here is just a comment section for notes, any important information. Again, you can mark down whether or not there's any things noted on the pre-anesthetic blood work or the surgical exam if the patient's on any current medications. In the case of a mass removal, whether or not the owner would like to send out a histopath. So any kind of information you can have in this comment section. The next set of paperwork that you want to make sure has been completed to go with the rest of the record is our authorization for sedation and anesthesia form. The owner's signature is present on this form, and that their name, pet's name, and the procedure being performed today. This form should ideally be filled out before you start any anesthetic procedure. The other one is a disclosure form, basically just giving us permission to treat the pet. Again, make sure the owner's signature is on this form. Once all of these forms have been filled out and completed after our procedure, it's important that we can keep a detailed log of the controlled substances that are used. The substances that are controlled are required to be logged here in some sort of log form. So our things have the drug name, the form that the drug is in, tablets versus injectables, the strength, the bottle, the quantity, and some sort of identification, whether using a number or a letter to identify the bottle that's being used, the dates it received, the lot number, and the expiration date. The rest of the information is the date that is the date that's been used, the information regarding the client, such as the account number, the owner's full name, the patient's name, the species, the employee, so the doctor or technician that is administering and logging the medication, the initial amount in the bottle, or the amount from previously, the amount that is used, and anything that may have been wasted. The medications that we are using for this patient, for example, would be buprenorphine. So I'm going to find the buprenorphine log. And again, this is our buprenorphine. The bottle number matches the bottle that I used. And I'm going to go ahead and just fill out the information with the date, the last name, the identifying account number, species and pet name, the initials of myself and the veterinarian, the amount that was used, and I'm going to be nice to the next person and do the math so that the initial amount will be what is left in the bottle. The other medication is diazepam that we'll be logging. Same information, the date, the pet's name, the account number, species, pet's name, the initials of the prescribing doctor, the initial amount should already be tallied for you, the amount that was used for today, and then the new remaining amount. And nothing was wasted in here. So our drugs are logged. All of our information is completed on all forms. Signatures are double checked and everything here. So now this, we use a digital system, so all these papers will be scanned and attached to the medical record for any future reference.